In this recording, we'll discuss the mouth, teeth, and salivary glands. Your mouth, sometimes referred to as your oral cavity or your buccal cavity, this is where we start digestion. Okay? We have a couple of structures that we want to acquaint ourselves with. We have the labia, better known as your lips, which protect the anterior portion of the oral cavity. Your cheeks, which form the lateral walls of the mouth. Your hard palate, which forms the anterior superior portion of the oral cavity. This is coming from the maxilla and the palatine bones. The soft palate forms the posterior superior portion. This is composed of skeletal muscle covered by a layer of mucous membrane. Okay, so your hard palate, your soft palate, that's the roof of your mouth. Okay, the hard palate is the front portion. The soft palate is the back portion of the roof of your mouth. The uvula, which is kind of hard to say. The uvula is the little projection at the back of the soft palate. It's a little thing that hangs down the back of your throat. This helps prevent food from entering the nasal cavity when we swallow food. So we don't want our food to go up. We want the food to go down. And then the frenulum, these are little folds of mucous membrane that secure the tongue to the floor of the mouth and the lips to the gums themselves. So let's see, we've got a picture here. All right, so teeth, everybody knows teeth. We've got gums. Hard palate is in the front, soft palate's in the back. Your uvula's dangling down. And then your, let's see, yep, here's your frenulum. Okay, so you've got that little tiny flap of skin that holds your top lip onto your gums. And you've got the same thing on the bottom to hold your bottom lip onto your teeth or your gums. And then under your tongue, okay, that other little fold of skin that holds your tongue to the bottom, okay, that's the other frenulum. Okay, now teeth, we also have plenty of teeth. These help with mechanically breaking down your food or chewing your food, also known as mastication. Okay, your teeth themselves are housed in the gums or the gingiva. This is composed of non-keratinized, stratified, squamous, epithelial tissue. I know that's still a mouthful. And that is covering connective tissue that covers the mandible and the maxilla bones themselves. You have 32 permanent teeth, 4 incisors, which are the ones on the top, okay, and the bottom right on the front, okay. 4 on the top, 4 on the bottom, 8 total. Your 4 canines, your canines are the little pointy teeth right next to the incisors, 1 on top and bottom on both sides, for 4 total. Your premolars are next. We have 8 total, 2 on top and 2 on bottom on both sides. And then last but not least, 12 molars. This does also include your quote-unquote wisdom teeth. Okay, so we would have 3 on top and bottom on both sides. Now, obviously, if you have had your wisdom teeth removed, this number will be a little bit lower for you, and that's okay. Now, each tooth individually, okay, so here's an individual tooth, is covered with enamel. Okay, the top part is the crown. Okay, so this is basically the part that we see. Okay, these are the crowns. And then we have some cementum. Okay, the enamel is covering both the crown and the cementum, and all of that is on top of the root itself. The root would be basically what's below the gum line. Here we go, all of this good stuff here. Most of the tooth by volume is composed of dentin. Okay, dentin, and all this blue stuff here. Okay, and all of that surrounds a central pulp cavity. Here's your pulp. You can see in the pulp cavity we have both blood vessels and nerve fibers. Okay, if you see these little tiny white strips around it. These are your periodontal ligaments. Okay, these got mentioned way back in the discussion on ligaments. These are an example of gomphoses. Okay, these are immovable joints. We don't want our teeth wiggling around, right? All right, so that's teeth. Now, salivary glands. You have 3 pairs of salivary glands. It will not shock you to learn that your salivary glands secrete saliva. Okay, we'll talk about the composition of saliva here in a second, but briefly, we've got water, enzymes, mucus, solutes, all kinds of good stuff. The 3 sets are your parotid glands, your submandibular glands, and your sublingual glands. Your parotid glands basically sit on top of your masseter muscle. Okay, and if you remember, your masseter basically sits right in front of your ear. It's your big chewing muscle on your jaw, back of your jaw. Your submandibular gland, we know that submandibular would be under the mandible. Okay, specifically under the mandible towards the back of the tongue. And then sublingual would be under, lingual is tongue, so under your tongue. These would be more anterior to your submandibular gland. So submandibular gland under, but towards the back of your tongue. Sublingual is also under, but this is more towards the front of the tongue. So you can see your giant parotid gland. Okay, and then we've got submandible towards the back of your mouth, and then sublingual right on your tongue. This is kind of a terrifying picture. It's kind of scary looking. Okay, but we can see the little ducts all emptying into the oral cavity itself, and you can even see the percentages. So as large as the parotid gland is, it's only about 30% of the secretions. The submandibular gland, although it's smaller, okay, accounts for up to 70% of your saliva. Your little sublingual glands are only about 5%. Now, saliva, we said we'd talk more later. Here we are at later. Your saliva is mostly water, and that will not shock you. We're talking about 98% water and electrolytes. These are the same electrolytes that we've been talking about forever. Sodiums and potassiums, also chloride ions, things like that. The pH of your saliva is slightly acidic to neutral. We're at about 6.75 up to a 7 even. And output is 1 to 1.5 liters per day, which that's a lot of spit, y'all. Let's be honest. 1.5 liters of saliva every day, that is a lot of spit. Now, one of the components of your saliva is mucin, which is a component of mucus, and I know that's a little confusing, okay, but the mucin helps thicken up the mucus when it's dissolved in water, and this helps keep the mouth lubricated, and it also assists with the hydrating of the food as you chew. Okay, you don't want the food to dry out. It's more likely to get stuck in your throat as you swallow if it's too dry. Now, one of the other things that we find in the saliva is salivary amylase. This is responsible for starting the process of carbohydrate digestion. Okay, we are going to start breaking down starches into simple sugars. Now, I mentioned this is the start of the process. You do not completely digest carbohydrates in your mouth, you just start the process. And you only start the process of chemically breaking down any macromolecule here in the mouth. The carbs are the only one. So we don't start protein digestion, we do not start lipid digestion chemically in the mouth. Okay. Now, obviously, mechanical digestion, just chewing, we start to mechanically break down everything in the mouth. But chemical digestion, where we use enzymes, the only thing that we are chemically digesting is starches in the mouth. Now, the process of salivation, okay, is activated by a couple of things. Food entering the mouth. So if you've literally put food in your mouth, you start to make saliva. Parasympathetic nervous system stimulation. Your parasympathetic nervous system is your rest and digest. Okay. Literally the sight or smell of food, y'all. Okay, so if you've ever felt like you saw really good looking food or smelled really tasty food and your mouth watered, that's not really an exaggeration. That is actually how it works. Becoming nauseous, which that one, we probably don't really think about that one a whole lot. But if you can think back to the last time you felt nauseous, you may have noticed that you had a little extra spit going on inside of your mouth. That's just kind of gross. Bacterial toxins in the GI tract can lead to excessive salivation. Spicy foods or hyper acidic foods can also lead to excessive salivation. So lots of different ways to activate the production of saliva. Now, the mouth has three main purposes in life. One is to ingest the food. I don't think that one really needs any more explanation, y'all. You put food in your mouth. There you go. Ingestion. Mechanical digestion of food. We've started to mention that a couple of times here and there. Physically breaking down the food. We know it as chewing. Science knows it as mastication. Your tongue gets involved by mixing the food with saliva, and it turns your food into a bolus, which is basically a ball of food. Okay, the bolus is what you will end up swallowing. And then we also do have chemical digestion. We just mentioned the salivary amylase and its role in the chemical breakdown of starch. We start to hydrolyze the starch into glucose molecules. This can take anywhere from 15 to 30 minutes, which you know that you do not chew the same bite of food for 15 to 30 minutes, which is why we say we're really just starting the process in the mouth. We finish it a little bit later. The starch breakdown is actually inactivated by the acids in the stomach. So we start in the mouth, we kind of pause in the stomach, and then we'll pick up again in the small intestine.